Northwest Health Services is a federally qualified community health center. We serve the rural and urban population of Northwest Missouri. We have clinics in St. Joseph, Savannah, Mount City, Oregon, King City, Bremer, Gainesville. We serve Medicaid, Medicare, commercial insurance, and discounted program for the individuals. Depending on the site of the clinic, there is a little bit difference, but more or less Medicaid and Medicare are the mainly targeted population. I would say around 50 to 60% are Medicaid and Medicare patients. The rest are commercial insurance and sliding scale. We are in the 7th year of EMR. It has helped me realize if I'm doing a good job regarding taking care of my patient, if I'm following the chronic care indicators, the quality measures for the patient, and it has definitely helped in preventive medicine. It has decreased the amount of hospital visits and has helped us increase the patient education. Physicians have a tendency to free text a lot, and they don't realize at times that whatever is free text is helpful for the next patient visit, but if you want to run it against a database query, it won't be useful. That information cannot be collected or used against the database queries. Whatever information you collect in the form of drop-down menus or a checkbox item can be only collected. We always ask the patients to stop smoking, and we discuss about the intervention and the cessation counseling. But there have been occasions wherein we forget to document in the EMR. So this tool helps us to remind and to make sure that every time the patient walks in our office, we can discuss about the smoking cessation programs. At times there is a discordant of the patient complaining that I have been taking my medicines on a regular basis, but I don't know what's going wrong. And the physician feels that maybe the patient is being non-compliant. It helps remove that discordant. It helps in more communication. And this is more targeted towards the patient-centered medical home, wherein the communication is coordinated, accessible, and centered around the patient. If a patient of mine, for example, comes for a pre-op history and physical to get a surgery done in 2 days, I can get the labs done in my office and fax it. We are in the process of implementing the Health Information Exchange, LACI, Lewis and Clark Information Exchange, with the local hospital heartland, wherein the information can be seamlessly transmitted from our clinic to other clinics as well as the hospital. So this way, patient does not have to pay again for the imaging study or the labs. And it helps in more coordinated communication between the primary care physician, the other specialist. The duplication of the labs, the imaging studies were reduced significantly. Patient information could be captured securely and transmitted between the primary care physician and the other specialties. For example, if a patient gets a stress echocardiogram, they do not know their results and they come to my office, I can actually print a copy of their report and hand it to them, explain to them what happened and what measures they need to do, the medication or the lifestyle changes they need to do accordingly. So it has helped us a lot in that way. Then the third point would be the chronic care indicators. It helps us tab if the labs have been done properly, if more we can follow the preventive medicine, reduce the ER visits and the hospitalization for the patients. What used to happen is when you get those faxes, they can be lost in the big stack of papers. But now everything is charted accordingly in the lab section, in the EEG section. If you get an ophthalmologist report or a neurologist report, it is charted accordingly. And I can pull up if my patient has been seen in 2009 or in 2011. It helps us to reevaluate the patient's condition. Some patients have been unhappy because of the decreased physician-patient eye contact, because of the documentation. In this regard, what we are trying to do is develop a KRS Plus model at one of our sites, wherein a nurse goes with a physician, helps with the documentation, orders, lab studies, assessment and plan. The physician is responsible for reviewing and signing off the chart. But this has helped improve the performance, and we are going to implement this model throughout the Northwest Health Services. We have adopted and implemented the meaningful use of the EMR. We are just waiting for the attestation for the meaningful use.
Okay.
We will be easily able to demonstrate the first level. The level 2 and level 3, we are looking more into that. The first phase was fairly easy. The second phase and third phase, few points might be missing, and we are already working on it. So in the subsequent years, as we go forward, it should not be difficult for us to achieve it. Our 3 sites in St. Joseph are level 3, NCQS certified, National Committee for Quality Assurance certified, patient-centered medical home. This is the highest level of recognition. This helps us provide quality care to our patients, and the patients can be assured what kind of care they are going to get in our clinics. At this stage, all the physicians are happy, and they do understand that in the future, quality measures are the way for reimbursement. If there is improved quality care, the reimbursement for the physicians as well as the community health centers is going to increase.